So a transaxillary breast augmentation is a breast augmentation where we make an incision in the armpit or in the axilla and then place the implant through that incision. What's changed with that procedure is nowadays when we make that incision in the armpit, we use a TV camera or an endoscope placed through that incision, and that allows for correct implant placement. The biggest benefit of doing a transaxillary breast augmentation is there's no scar on the breast. The whole purpose of this operation is to enhance the appearance of the breast. So any scar on the breast, even if it heals well, is still a scar on the breast. So by placing an incision in the armpit, there is no scar on the breast, and your eyes are drawn back to what we were trying to make look better in the first place, which of course is the breast enhancement procedure. So the biggest benefit of using an endoscope when placing an implant through the armpit or through the axillary incision is that you can get the implant in the exact position that you want. When the operation was first described, it was more or less a blind procedure where we made the incision, we're already under the pectoralis major muscle, and then we would, for lack of a better term, we would rip or tear the muscle to open the pocket. So when we use an endoscope, you can then more precisely cut the muscle and make the pocket without tearing the muscle or tearing the pocket at all, which leads to a slightly quicker recovery and almost zero risk of implant malposition. So Keller funnel, this was a great invention. So after we make any incision and place an implant, and we used to have to take and force the implant through that small incision. Two things happen. One is sometimes we could damage the implant, but it's cohesive gel, you couldn't tell. And the second thing was there was too much contact of the implant with the skin. So now using a Keller funnel, we can make the incision and then cut the funnel to fit the implant, and then put the funnel into that incision, and then we can squeeze and kind of squirt the implant into the pocket. So in that case, it puts a uniform stress on the implant, and then the implant never touches the skin, which would then decrease the risk of, I believe, of capsular contracture and make it no higher than through any of the other incisions.